This is Eyewitness News, now at 4.
Our panel of doctors here to help again live on Eyewitness News. Because of the overwhelming response from our first Ask the Doctor forum, for the next half hour, these experts are joining us live to answer your questions about the pandemic. Thanks again for joining us here on ABC7, ABC7.com, and streaming wherever you are on the ABC7 Los Angeles app. Ellen and David are off today. I'm Giovanna Lotta.
I'm Mark Brown. More cases, new concerns as the number of coronavirus cases continues to climb. Health officials here in Southern California are concerned about another spike this 4th of July weekend. That's why we have devoted the rest of this newscast to answer your questions about the pandemic.
And we're joined by Dr. Nicholas Testa, the Chief Medical Officer at Dignity Health Southern California. Dr. Testa, this question is for you. Maria in Covina asks, if you travel out of state, should you self-quarantine when you come back automatically or only if you have symptoms?
It's a great question. So there's been now some additional laws passed, or I should say policy passed, around travel and quarantine. So if you're traveling from LA to New York City, you actually have to self-quarantine when you get there for 14 days. Right now, there is actually not a recommendation for self-quarantining for returning back to Los Angeles. I think you really need to read what's going on in the individual areas where you're going and determine what the recommendations are upon returning. If you have symptoms, you should certainly get tested and self-quarantine.
Okay, now this question for Dr. Dodd. It comes from Jay in Manhattan Beach. When I shop at Costco, I always wear a mask and gloves. When I get home and carry all the big boxes into my house, I remove my mask and gloves. Should I also remove the clothes that the boxes touched out of an abundance of caution, we suppose? Dr. Dodd?
We do know that the virus, if indeed you become in contact with somebody that has the virus can still liable in certain surfaces for X amount of time. For example, in plastic bags and in cartons, studies have shown that the virus might stay alive for a few hours. I would say that very much it will depend on how much contact your bags might have with your clothing and what might be the risk factors that you might face. If you are an individual in whom you have high risk, diabetes, high blood pressure, and things like that, besides washing your hands and removing your mask and cleaning or getting rid of the plastic or boxes that you carry, then perhaps you might want to go ahead and remove your clothing. It's up to how well you're doing. I don't know that I will do that every time I will go to the store. I do it when I come from the hospital, but that's a little different scenario because we're interacting with individuals that might be very severely ill, and you might become contaminated on your clothing. Yeah. So that might be an option if you want to be precautious.
Okay. Thank you. And we have an Instagram question for Dr. Mayorga. If I'm out in public for an essential reason, is it safe to use a public restroom?
You know, a lot of folks are asking this question when they come into our clinic. One of the things that we do recommend is to, if you cautiously use the restroom. Of course, remember this infection is spread by respiratory droplets and it's not airborne per se. So we want to make sure that when you do use the restroom, avoid touching your face before you actually come out of the restroom. So in other words, use the facilities. Wash your hands with soap and water, and if possible, if there is a paper dispenser, use that as an opportunity to open the handle and walk out the door.
Okay. Don't touch anything if you don't have to. All right. Yeah. Dr. Cardillo, this is from Dick in West Hollywood. He asks, if two people wearing masks pass within a few feet of each other, say in a market, and one is asymptomatic and the other is virus-free, and neither one coughs, sneezes, or talks, can the virus be transmitted from one to the other?
Okay, if those two people are asymptomatic and they don't have symptoms of that virus, and they're not sneezing and coughing and they're wearing a mask, that's what we're trying to get at by having everyone wear a mask. Because in that scenario, we're not going to have significant or any transmission of viral particles. Because these are asymptomatic people that are not coughing, not sneezing, that are actively shedding viral particles. That is a really safe way to keep everyone, healthy, is just wearing the mask and not going out if you're symptomatic. These are people that are asymptomatic, wearing masks, very, very little, if any, transmission risk in that scenario.
Okay. All right. Thank you, Dr. Cardillo. And we need to take a quick break, but still ahead, can you catch coronavirus from the food you buy or from using a public washing machine?
And what about your chances for immunity if you take one of those antibody tests? The doctors are answering those questions and more coming up. Stay right there. We want to welcome you back to this special edition of Eyewitness News, the Ask the Doctor edition of Eyewitness News at 4:30.
We're spending this entire half hour getting answers to your COVID-19 questions from 4 local doctors. Thanks again for being with us. And our first question, this one for Dr. Testa. Steve in La Palma asks, I share washing machines with my fellow apartment tenants. Is it possible to contract COVID from washing clothes in cold water? Is it any safer washing in warm or a hot setting?
You know, I think if you're using detergent, your clothes are going to be clean and you're going to kill any COVID virus. It's similar to the swimming pool question that Dr. Cardillo answered. You know, that's not really where you're going to contract it from. Where you have to be cautious is these are high contact, high touch areas. So I think your clothes are going to be clean, and I don't think you're going to get COVID-19 from the water in the washing machine. Where you got to be cautious is all those other surfaces you're going to be touching, where you're going to be folding your clothing, and remembering to use those really good precautions about washing hands or wearing gloves in those areas.
So maybe the door handle on the laundry room might be more of a threat than the clothes, obviously. Okay,
exactly.
Good to know.
It's
all right.
The high volume areas.
Okay.
Dr. Testa, Jennifer in Chino Hills is asking, is there anything we can do from home to minimize the effect and severity when we do feel ill, but don't think we are at the level where we need to go to the hospital?
Yeah, absolutely. And we have to remember common sense. So we want to do all of those same things that we do when we get the common cold, right? Because for all intents and purposes, it will be the common cold for many people. And so we want to stay well hydrated. We want to rest, right? We want to keep our fever down. But I think the most important thing isn't about what we do for us. It's about what we do for our community around us. So if we are sick, we really do have to quarantine. We really have to stay home. We have to stay away from those that we love and who are around us. And we have to protect those individuals, because that's really how we can contribute to stopping this.
Okay, thank you, Dr. Testa.
Back now to our Ask the Doctor questions from viewers like you.
Our 4 local doctors are still standing by live, so let's get right back to your questions right now. An Instagram question for Dr. Dodd. What precautions would you recommend taking when going to a hotel during this pandemic? Dr. Dodd?
Well, when I make my reservation, and I will be very careful, but when I make my reservation, I will make sure that they're actually following all the recommendations from the CDC. They're careful in terms of how many people are staying in the hotel, that they're cleaning surfaces. I will make sure that myself, I'm wearing a mask, and that other individuals that are there to greet me or be with me are wearing a mask as well, and that they're very precautious in terms of keeping a distance person to person.
Okay, thank you. And Dr. Mayorga, Anna in Artesia writes, I have an appointment for teeth cleaning and a dental implant surgery in which I have to continue opening my mouth for about an hour. Is that safe at this time?
You know, I really like this question a lot. Currently at our health center, we also provide dental care. And so we've taken this extensive precautions here at UCI to ensure that we can provide the care when needed. If you look around what's happening in the dentistry community, those clinicians have done quite a bit of work in trying to protect their patients as well as their staff. A lot of them have implemented steps where they're not using high-speed equipment, similar to what we're doing, and it's really all hand tools. So really, at this stage, it's very well known that dentistry has taken a lot of precautions. Some of them have taken even more so with regards to adding additional equipment and barriers, not only for the patients, but also for the individuals that work there.
Okay. We have a question for Dr. Cardillo. It comes to us from Andrew in Irvine. Can coronavirus live on the bottom of your shoes? Should you disinfect your shoes when you come home?
That's a great question. In fact, I was just reading an article yesterday where they tracked in a large hospital facility, and they wanted to see where the greatest percent of the coronavirus was found. And what they found, it was on the floor, all throughout the hospital.
Wow.
So when they swabbed all the different surfaces in that hospital, door handles, knobs, everything, and then floors. They found the floor had the highest concentration. So you can imagine, we know that, like we're discussing, when people sneeze and cough, it's a droplet that falls to the ground. So those droplets are, on the floor everywhere, and they're being transmitted as you're walking. They also found, interestingly, that in the in-hospital pharmacy, that's where the greatest number of viral particles are found, on the floor. So if you extrapolate that to our own lives, the answer is yes, that you should definitely be mindful about changing your shoes, wearing shoe coverings. I know most of us in the professional health space are wearing shoe coverings, but if you're out and about and you come home, it's probably wise at this point to start adopting the no shoe in the house policy. Now, I've never been a big fan of that myself personally, but I've certainly changed my behavior. And now our house is a no shoe house because of some of these studies. So I think it's just a great principle in general, but especially now and with some of this data that's coming out. So great question.
Yeah, for sure. And great answer to that, too. Who knew? Okay, Linda in Monterey Park writes, I have a roommate who is in Colombia and will be returning in September. What precautions do he and I need to take to ensure our safety upon his return? And that question for Dr. Testa.
Sure. So when we talk about international travel, we have to look at where we're seeing outbreaks, right? So forgive me for not knowing exactly what the situation is with COVID-19 in Colombia, but let's just assume that they're experiencing a large outbreak right now. And, if that's your roommate, one of the first things you're going to want to ask yourself, as going back to that first question, is this a time that we need to quarantine? And using good judgment, you may need to quarantine from that person for 14 days. And doing that in a house where you have a roommate is tough. So, you can do it by staying in separate rooms and setting some clear barriers to how you're going to be in this room and they're going to be in that room, and what we're going to share and what we're going to not. There's limitations to how well we can do that. And some people just will not be able to do it where they're actually in full separate places all the time. And then we just have to use really good precautions around washing our hands and not sharing soaps and some of those things that we may commonly not think about, like dishware, things like that, really separating it and indicating that that person is to use these dishes or these plates and so on. But the most important thing is we look at the country where they're coming from, and we look at what is the level of outbreak that we're seeing in that country.
All right. This has been a very informative session. We want to thank all of our doctors. That's it. That's all the time we have for our Ask the Doctor Forum today. We're going to do this again soon. And we want to thank all 4 of our doctors for joining us and for answering these important questions.
And thank you to everyone who submitted a question. And we know we couldn't get to every question we received, but as Mark mentioned, we will continue to answer your questions in the days and weeks ahead here on Eyewitness News. So keep submitting at abc7.com/coronavirus. Just click on Ask the Doctor.